name's Emma Holly and I'm a scar therapy expert. I have a clinic in London's Harley Street and I also teach professionals working in NHS and private practice about scar care, scar massage and use of devices to help promote scar healing. If you're watching this video, you've had a C-section, or perhaps you're supporting somebody who's had a C-section. I'm going to go through some tips about how you can look after and care for that scar to promote an optimal recovery, but also this will be useful with mature scars as well. So the first thing you need to do is make sure that the scar has no infections. If you start spotting a sign of infection, please go back to the medical team as soon as possible. An infection will lead to more scar tissue production, which is not what we want. So signs of infection could include redness, weeping or oozing from the scar. The scar could be becoming increasingly painful. There could be a rash or discoloration around the scar, blotches and changes in the textures of the skin. But there could be also systemic symptoms such as headaches, nausea and general feelings of being unwell that you might associate with another kind of infection. In any of these cases, it's really important not to touch the scar at this point. So when should you start with your scar massage? You need to make sure that there's new skin growth all over the scar, so that means there shouldn't be any scabs left. Once you've got this, you can start with some really gentle massage and start using products to help support your scar. There's a whole range of products. I always encourage people to go for products which are evidence-based to help with scars. The products that I choose in clinic tend to be from the company Scarban, which does a lovely C-section medical grade silicone kit specifically for C-section scars. Also the product Hydrate, a lovely cream, evidence to help reduce some of the symptoms of scarring and promote healthy scar tissue, such as itching and tightness. And then also a lovely silicone gel BAP scar care, which again is really helpful in early healing. And there's another company that I really like called Coat, who do a range of scar creams as well. All of these are evidenced and have had clinical studies to show that they help with scar care. There are also some great natural products on the market if you prefer that. Rosehip oil is really well known and evidenced to help with scars, and there are some essential oils which are really helpful too. If you're going to go with a natural product, see an expert and get something that's really well made. If you can, buy organic. What I would say is avoid things with too much perfume. Anything that is going to irritate your skin is not a good idea, because that again could irritate your scar and lead to more scar tissue production. You should be putting cream, gel or oil on your scar 2 to 3 times a day as soon as you've got new skin growth. Keeping your scar well hydrated and moisturised is really important, and again it has evidence to show that this helps promote healthy scar tissue. What you want is a nice hydrated and moisturised scar once you've got that new skin growth. So not while it's still an open wound or while there's any scabbing, but the minute that's gone, start getting that cream, oil or gel on and looking after your skin. It can feel really strange touching that scar for the first time. It's likely that the sensation in the area could either feel totally numb or just really weird or a little bit tender and painful. So go very lightly and gently. And if you find it too difficult to touch the area yourself, see if you can find somebody that you could help you with putting some oil, cream or gel on. How should you be massaging your C-section scar? When you're working with scar tissue, particularly during the early few months of healing, please only use a very light touch. The touch that I would recommend is if you put your finger over your eyelid and you just press lightly, and it shouldn't feel painful, so you can feel your eyeball but you're just moving over it. If you're pressing harder than this and you're still in the first couple of months after having your surgery, you're pressing too hard. There is different advice out there. It could be that the consultant has told you to massage your scar really hard. It could be you've watched another YouTube video. The reason for my suggesting a light touch is if you go too heavy and too hard on your scar tissue, you cause irritation and inflammation. If you cause irritation and inflammation, you can cause a chain reaction to make your body produce more scar tissue. Using a light touch on short regular sessions is the best way forward, and as that scar tissue matures you can gently step in with more pressure over a series of weeks and months. Going in too fast and too hard too early on will not be helpful for your scar. Believe me, I've been working as an expert within this field for years, and there is a tide of change coming to show that light touch is the right way. So what kind of techniques can you use to massage your C-section scar? First of all, with this very light touch, I'd start with a broad area. So over the area, some light sweeps just to start making contact with that area. If you go back and forth over the scar, what you're doing is you're helping to stimulate the nerves in the area, which will help normalise that sensation. And you're also helping the body to clear away any debris that's produced. So it's a kind of decongestive move as well. Really good to help support scar healing. So I would do light stroking back and forth, maybe 1 or 2 minutes to start off your scar tissue massage. And during the day, if you want to do this for a couple of minutes at a time, don't overdo it. You can do it through clothes as well if that feels okay to you. Keeping that touch really light and gentle. Once you've warmed up that scar with that nice gentle stroking, you could then do more of a pumping action. Again, that's going to help clear the area, break down some of that fibrotic tissue that may have started to form. So then working with your fingers, just pressing into the tissue, lifting off and moving along. Going back and forth, light touches, pushing in all along the area where your scar is. Just push deep enough until you can feel a slight resistance in the tissue so that the tissue feels a little bit firmer, and then let go again. It's not about prodding hard and trying to have more of a broad area than to be too up in your fingers so that you're pushing down into the scar itself. You're looking for flat fingers making contact. So this is best done when you're lying down. The sweeping technique, you could do that even standing up if that's easy for you to remember, maybe when you're brushing your teeth or something like that, because 2 minutes would be about the right time. Then maybe after sort of week 8 to 10, you might want to start thinking about doing some stretching techniques, because once the scar starts to mature, you'll get some thickening as the collagen changes within that scar tissue. I like to use a scissor movement with 2 fingers, so 2 fingers together and stretch. And just go back and forth over your C-section scar with this light stretching movement. You can just hold with the fingers apart when you're at the point of stretch a little bit, and that will just help to tease open that scar tissue. Keep stretching those fibres. Light circles around the scar are really good as well. So what kind of symptoms can scar tissue from a C-section go on to create? It could easily create some pulling and tightness around the C-section. People often end up with an overhang, so that means like a bit of tissue that hangs over the C-section, because the tissue from the C-section scar is never going to have the same flexibility as the healthy tissue around it that hasn't had the surgery. While we might not be able to help this restore completely, what you should be able to do if you start treating your C-section is get an improvement from where you're at now. It's also symptoms are common, such as backache and hip pain, pulling sensations. If you've got problems such as diastasis, the C-section could be interfering with that. That's when your tummy muscles split during pregnancy, and it's really important to get that addressed soon, because that could lead to herniation. If you're not sure about how you feel about your C-section, please do get in touch with me at www.restoretherapyclinic.co.uk, or if you're based somewhere else in the UK, I train practitioners all around the UK and should be able to signpost you to find a therapist near you. So hopefully you've gleaned some really useful tips and ideas for looking after your C-section. Even if your C-section was many years ago, even decades ago, doing some scar massage on it can still be really helpful. And certainly if you're getting any of the symptoms that are associated with scar tissue complications, it's never too late to go and get treatment. I really wish you well over the next few months, and remember, little and often is a great way to keep up your C-section care. Bye everyone!